Someone wanted to know about optic nerves swelling condition, which I had shared with you guys in one of my vlog, and subsequently I had prepared a video for my lumbar puncture experience. So I'll check that comment and I'm trying to reply to that comment, and this video is about side effects of Diamox which I'm taking for my optic nerves swelling. So through this video I'm trying to help someone who's undergoing this kind of condition where they are found with idiopathic intracranial pressure, or for some reason they are on Diamox. So I'll try to look for the comment on my video and will try my best if this video can reach to that person. Again, I will say I'm not a medical practitioner. I'm a patient who was on Diamox. Diamox is a brand and the medical name of this medicine is Acetazolamide. Acetazolamide. So I hope I'm pronouncing it right. But this medicine is quite famous amongst mountain trekkers. They take it for altitude sickness too. But there were more videos of mountain trekkers in YouTube when I was searching for side effects of Diamox. So I thought, why not, I should make a video and share my experience, how I was coping up when I was on 16 tablets a day. So if this video doesn't serve your purpose, you can always skip by. Idiopathic intracranial hypertension is kind of raised brain pressure, and it's due to unknown reasons, so that's why they call it idiopathic. So idiopathic intracranial pressure can cause optic nerve swelling or any other damage, I guess. So in my case, my optic nerves are swollen, so which can cause permanent blindness. So we are trying to fix that problem. Diamox is not only for idiopathic intracranial pressure. Diamox is given for other medical conditions as well, especially mountain trekkers. They use it for high altitude sickness, and it's also given for other eye conditions, especially with diabetic people. So Diamox is given for glaucoma, altitude sickness, paralysis conditions, and in some cases heart failures too. So I will share my experience of Diamox with you guys, because when you go to doctors tell you, think about this medicine. This medicine has got lots of side effects, and it becomes so scary the way they explain and the side effects are shared with us. So there are few unlucky ones who have severe side effects, but majority of the people are fine with Diamox because Diamox is quite safe, and when you read a lot on internet, it puts you more on anxiety. So I thought I'll share my experience if that puts you at ease. So when I started taking Diamox, I started with a half tablet of 125 grams. So slowly they increased to 16 tablets a day. So first I will talk about the side effects of this medicine which are told to us and what all side effects I actually had. So I was told that I will have sleepiness, drowsiness, and numbness or tingling sensation in my fingers and toes, and I will have dry mouth, and I'll have increased feeling of going to urination. And there will be some side effects if I have kidney or liver conditions. In my case, I had some kidney conditions, so I was watching my kidney condition through blood tests. So I was asked to eat 2 bananas a day to keep my potassium level in control. So these are the side effects doctors tell us, and I'll share my experience what exactly I had while I was on this medicine. So when I started with half tablet, first day was a bit difficult. Half tablet was making me really drowsy and sleepy, and I remember there were 16 hours in the day when I was continuously sleeping the whole one day, and there was drowsy feeling. You don't feel like talking to people, and optic nerve swelling in any case gives you some sort of blurriness. Sometimes you're fine, and sometimes when you're looking into your phone, it's kind of blurry. Or for 2-3 minutes you're fine, but the longer duration makes you uncomfortable when you are looking into your phone. So with this medicine, the blurriness was more, especially after consuming the medicine. And I will say yes, definitely you feel like going to urination again and again or more frequently. And yes, I had dry mouth, but I made it a point that I should be drinking lots of water so that there's not much acid in my body, because Diamox can affect kidneys. You know how kidneys, they produce bicarbonate, and which is acidic. So it's kind of some relation to producing acid in the body. So I wanted to get rid of that acid, and I made it a point that I'm drinking at least 2 liters of water while I'm on Diamox. And other than that, I was keeping an eye on my potassium levels through blood tests. So yes, I did have numbness in my fingers, but it was very minor, very little. And my toe fingers used to act a little funny. Sometimes I'll feel they are going, like they're bending. So that is kind of sensation probably I was having. So still it's manageable. It's not very bad. It's very, very light. But again, it depends body to body. So there are unlucky people too who have nausea or vomiting feeling with this medicine, or drowsiness. But yes, I will say I was getting drowsiness. So, but still I'll lie down and I'll have some rest. And I was not driving while I was on this medicine because I was not allowed to. And it's always good to avoid driving when you are on Diamox. So other than that, though I was not told about it, but I've read it, probably it's not because of exactly Diamox, but I've started having lots of hair fall, and I can see my scalp there. So it's all hair going, the density is going down, but that's with any surgery or any strong medicine. When you're on Diamox, please avoid soda and alcohol, because alcohol and soda is a big no-no when you are with Diamox, especially when kidneys and liver problems, they are releasing lots of acid in your body. With this medicine, it's always good to avoid more acid, especially fizzy drinks and alcohol. So this medicine actually helps you to reduce your blood pressure. So it's in a way positive side of that. But you can always consult your GP and monitor your blood pressure if you are on low blood pressure side. And so please make sure you are eating bananas, how many bananas your specialist or doctor has asked you to eat. So I was not missing on that because I was really concerned that my potassium levels shouldn't go down. Other than bananas, avocados, nuts, and white kidney beans, and there are a few other food which are rich in potassium levels. So you can consider having more of those sort of food in your diet. Also, to add, one of the major side effects which I was facing was sound sensitivity and light sensitivity. I had ringing in my ears. So that's also quite popular side effect, they tell, if you have intracranial hypertension. So ringing in the ears is actually not the ringing sound, but it was more like whoosh whoosh sound. So if I explain, it's how we feel before the takeoff of any flight. So how the engine is gearing up when it's about to take off. So that sort of whoosh whoosh sound keeps coming in the ears. So I was told by the doctors, so normally it's because the blood supply goes to the eardrums. So that was another thing I was having as a symptom. Or so after having this medicine, I was hoping that my optic nerve swelling will go down, but unfortunately it hasn't gone down. So now I'm concentrating on reducing my sugar levels. Last year when I had TIA, which is kind of mini brain stroke, my sugar levels were quite high. Probably this had caused optic nerve swelling. So now I'm concentrating on reducing my sugar level and reducing my weight too. So probably this can help reducing intracranial hypertension, or you can say brain pressure. That's my second line of treatment going on at the moment. So I'll keep you posted. And I know on social media we don't like to share our health problems, and we always want to share all the good stuff, all the happy moments, and try to show the world that we are happy, there's nothing wrong with us. But I will say, if sharing that information can help, why not share with the world that if there are adverse health conditions and you are in lots of anxiety and lots of, I will say, bad times going on, why not share with friends if they're learning from that? When people are not affected by any medical condition, then they are not that much bothered. But still, there will be some people who are looking for this sort of information. I thought it's my duty to share my experience, especially after receiving those comments on my YouTube, who was going through the similar condition, and she was wondering like me, what's this medical condition, and because it's not very, very common. So I hope this video will help someone somewhere who's undergoing idiopathic intracranial hypertension, or pressure in the brain, or raised pressure in the brain due to unknown reasons, or optical nerve swelling, or for some other reasons which I shared. They are on Diamox. So these are the Diamox side effects I was having while I was having on my dose, 125 grams a tablet. So I started with half tablet a day. Then I reached to 16 tablets a day for a month. I was continuously on this medicine, and I'm still on this medicine, but now it's last 2 months I'm on 2 tablets a day. So hopefully by next week I will reduce it to 1 tablet a day. But here in New Zealand now it's lockdown and my appointment is postponed, but I'm just waiting that very soon my further test will be done, and I hope, finger crossed, my optic nerves swelling is going down this time. So stay healthy, stay safe, and I'll be in touch with you through my vlogs or through my Bollywood movie reviews, and whatever interests me or whatever I feel like sharing with my tribe. So if you wonder what is tribe, people who subscribe to channel, who are my friends, they are in my tribe. So if you want to stay connected with me, you can subscribe to my channel, and or if you want, you can follow me on Instagram with the same name, manishamunmaujinz. Bye.